Hello everyone, welcome to the Nursing Virus YouTube channel. This is me Loganathan. This video regarding CRPF previous year question paper which was held on the year of 2014. All the questions and answers were discussed along with the suitable rationals. The part 1, the question number 1 to 25, I'm going to discuss in detail. Before going to that question discussion, we'll see the exam pattern for the CRPF staff nurse or sub-inspector post. Totally you have the 100 questions with a 2 hours duration exam. The part A 50 marks, that is general intelligence and reasoning 10 marks, and the general awareness 10 questions and 10 mark, and numerical aptitude 15 question 15 mark, and that English and Hindi comprehension 15 question. This all together 50 questions under that part A. These all questions which is level based on the 10th to 12th, and for the part B totally 50 questions. Each question carry 1 mark. All the questions related to the nursing profession only. This was a exam pattern for the upcoming CRPF staff nurse exam pattern. So the upcoming written exam date 20th December 2020. So for if you are not subscribed on my channel, subscribe and click the bell icon. For the Facebook page, follow on Nursing Virus page. So the question number 1. Rupture of tubal ectopic pregnancy is treated surgically by salpingectomy, oophorectomy, hysterectomy, and vasectomy. So the correct answer is salpingectomy. The salpingectomy is nothing, that is a surgical removal of the fallopian tube, whereas the ectopic pregnancy commonly will used to happen in the fallopian tubes. So when it is happening in that fallopian tube, the tube can be removed completely. The other options are oophorectomy, that is a surgical removal of one or both ovaries, and hysterectomy, the surgery to remove the woman's entire uterus, and vasectomy is the surgical procedure for the male sterilization or the permanent contraceptive method. Question number 2. On fetal distress, what is found in the amniotic fluid? Wernicke gaseosa, meconium, polyhydramnios, and bile. So the correct answer is meconium. So the rationale is the fetal distress, the baby experience oxygen deprivation, that is nothing birth asphyxia. So this may include the changes in that baby heart rate and decreased fetal movement, and the meconium in the amniotic fluid are the major signs for the fetal distress. Question number 3. Fertilization of ovum normally takes place in ampulla of fallopian tube, corpus luteum, interstitial end of the fallopian tube, fimbriated end of fallopian tube. So the correct answer is ampulla of fallopian tube. This is normally the fertilization process will start to begin. McDonald suturing is done in which kind of abortion? That is missed abortion, septic abortion, recurrent abortion, and complete abortion. So the correct answer is recurrent abortion. Usually the treatment is done in the first or second trimester of the pregnancy for the woman who had one or more late miscarriage in the past period. Binovular twins form from one ovum and 2 spermatozoa, 2 ova and 2 spermatozoa, and 1 ovum and 1 spermatozoa, and 2 ova and 1 spermatozoa. So the correct answer is 2 ova and 2 spermatozoa. The binovular twins that develops from 2 separate ova which were fertilized at the same time of period. 6. Increased pulsation felt through the lateral formis at the 8th week of pregnancy is Hagar's sign, Jacquemus sign, Goodell's sign, and Osiander's sign. So the correct answer is Osiander's sign. So Osiander's sign is a pulsation in the lateral vaginal ornix can be felt during the time of 8th week. The other options are the Hagar's signs, that is compressibility of isthmus on bimanual examination, and B, Jacquemus signs or a Chadwick signs. That is a congestion of pelvis causes the bluish or purplish color of the vagina or the cervix part. The Goodell sign, the cyanosis and softening of the cervix can happen. 7. Chorionic gonadotropin is secreted by syncytotrophoblast, thyroid gland, ovary and uterus. So the correct answer is A. Syncytotoplast. That is a human chorionic gonadotropin, that is a HCG, is the placental hormone initially secreted by the cells. 8. Implantation of fertilizer ovum outside the uterine cavity is ectopic pregnancy, hydatiform mole, placental previa, multiple pregnancy. So the correct answer is ectopic pregnancy. On the picture you can see the normal pregnancy where it is happening that is inside the uterus area, the wall of the uterus. And that ectopic pregnancy you can see the embryo were forming out of the uterus cavity, that is in the cervix, interstitial area or the fallopian tube site and the ovary area. So when the fetus were forming outside that uterine cavity, that is called as ectopic pregnancy. And 9. Causative organism for the syphilis is Mycobacterium, Treponema pallidum and Vibrio and E. coli. So the correct answer is Treponema pallidum. So this is the major causative organism for the syphilis. 10th one. The following pelvis is usually associated with transverse arrest. So that means where the baby were not able to pass on the transverse diameters. That is anthropoid pelvis and android pelvis, gynecoid pelvis and platyploid pelvis. The correct answer is android. The android is the male type of pelvis or wedge-shaped pelvis. In mild deflection, the occiput rotates 1/8 circle anteriorly and the head is arrested in the transverse diameter. So the baby head cannot able to pass on the android pelvis. And 11th one, the permanent cessation of menstruation is amenorrhea, menopause, oligomenorrhea, hypomenorrhea. So the correct answer is menopause. So this will used to happen at the age of around 45 years and above. And 12th one, what is the purpose of doing fourth maneuver? A. To know the fetal part at the fundus. B. To assess the degree of flexion or attitude. C. To have an idea what the fetal part is. D. To know if engagement occurred or not. So the correct answer is to have an idea what the fetal part is. Actually, when you are doing the fourth maneuver, you can see which part of the fetus were engaged in the pelvis cavity, either that head or the breech. The fourth maneuver also known as Pavlik's grip. 13. Which of the following is used an emergency contraceptive? Combined oral contraceptive pill, progesterone only, Depo-Provera, levonorgestrel. So the correct answer is levonorgestrel. So a few of the contraceptive pills which is recommended by the WHO as the emergency contraceptive mean ulipristal acetate and levonorgestrel. These are the two contraceptive pills were recommended by the WHO itself. 14. Which of the following fetal position is most favorable for birth? Vertec, transverse line, frank breech presentation, posterior position of the head. So the correct answer is vertex part. So the vertex presentation is nothing, that is the flexion of the fetal head in the pelvis side. Is the optional presentation for the passage through the birth canal. 15. Contraception oral pills helps in the birth control by killing of ova, prevention of ovulation, killing of sperms and forming barrier between sperms and ova. So the correct answer is preventing ovulation. So the combination of the estrogen and progesterones work by preventing the ovulation. The release of eggs from the ovaries area. 16. What is the correct about test tube baby? A. Fertilization inside the female genital tract and grown in test tube. B. Rearing of prematurely born incubator. C. Fertilization outside and gestation inside the womb of the mother. D. Both fertilization and development are affected outside the genital tract. So the correct answer is C. Fertilization outside and gestation inside the womb of the mother. And 17th one, most important component of oral contraceptive agent is thyroxine, luteinizing hormone, progesterone, GH. So the correct answer is progesterone. So the progesterone is one of the most important component of the oral contraceptive pill. So what is the correct about amniocentesis? That is the withdrawing of amniotic fluid. That is A. Intrauterine diagnosis. Withdrawal of amniotic fluid from pregnant woman. And chemical analysis of fluid of pregnant woman. Culturing amniotic cells and the study of metaphasic chromosomes to identify the chromosomal abnormality. So the correct answer is withdrawal of allontonic fluid from pregnant woman. And 19th one, which of the following term is used to describe the thinning and softening of the cervix that occurs just before and during labor period? Options are ballotment, dilatation, effacement, and multiparous. So the correct answer is effacement. 20. Which of the following complications is possible with an episiotomy? Blood loss, uterine disfigurement, prolonged dyspareunia, hormonal fluctuation, postpartum. So the correct answer is prolonged dyspareunia, that is a painful intercourse. 21. One of the complications of hyperemesis gravidarum is increased vomiting, dehydration, corticopsychosis, low blood pressure. So the correct answer is increased vomiting. So this is one of the major complications of hyperemesis gravidarum. The woman will used to have the more episodes of vomiting sensation entire pregnancy period. 22. Greenish yellow color of amniotic fluid indicates fetal distress, RH incompatibility, post-maturity, IUD. So the correct answer is post-maturity. So the yellow color amniotic fluid indicate fetal bilirubin, erythroblastosis fetalis, and green color indicate meconium, breech presentation, fetal death, defecation, IUGR, and post-maturity. And the red color indicate presence of blood and IUD, and port wine color indicate fetal distress, abruption of placenta, and brown color indicate oxidized hemoglobin, maternal tissue trauma, fetal death, and fetal macration. So this is one of that important question for that amniotic fluid discoloration area. 23. The placenta should be delivered within how many minutes after the delivery of the baby? 5 minutes, 30 minutes, 45 minutes, 60 minutes. The correct answer is 30 minutes. Actually, in practical session, we'll used to consider from 30 minutes to up to 60 minutes for delivering of the placenta after the delivery of the baby. Oxytocin causes all except lactogenesis, milk ejection, contraction of the uterine muscles, myoepithelial cell contraction. So the correct answer is lactogenesis. So the lactogenesis is the process of developing that ability to secrete the milk and involved in the maturation of alveolar cells. So this is that thing will not happen due to oxytocin. 25. Premature separation of normally situated placenta is called placental previa, abruptio placenta, placenta accerata, placenta increata. So the correct answer is abruptio placenta. That is a premature separation of the normal placenta which is situated in the posterior or anterior part of the uterus. So other options are the placental previa. So when the placenta covers the opening in the mother's cervix, so either it will be partial or incomplete types. Further types we have. And the second one, placenta accreta. The placenta grows too deeply into the uterine wall. Typically the placenta detached from the uterine wall after the childbirth. With the placenta accreta, the part or all the part of the placenta remains attached in the uterine wall. Already I have uploaded most of the previous exam questions subject wise. You can go and check that video description and playlist. Thank you everyone for joining with me. For getting all nursing government job vacancies and various nursing subject MCQs with the rational videos, notification, don't forget to subscribe my channel and click the bell icon. Thank you once again.